So what do you do for a living?
I am a doctor and I'm a certified psychiatrist in the UK.
What brought you here? Why did you travel so far?
I have been experiencing headaches for the last 8 months. I wasn't sure what the cause of it was. I have seen 2 ENT doctors, a couple of general practitioners, various dentists, physio, massage therapist, to try and look at what the cause of my headaches were. I was aware that I had an uneven bite from around 8 months ago, and I was told by one of the dentists that I saw that I had a condition called TMJ. So I decided to research the topic and found out about yourself and decided to come over. I was given 3 splints. 2 of them were rubber for the upper and lower teeth. They didn't help at all, and I was given an NTI appliance, which reduced the amount of pain that I experienced in the mornings, but was not a solution.
About 3 days ago we met and we screened you.
Yes.
What did the screening mean to you? Did you understand what we did? I mean, did it make sense?
Yeah, so I think one of the big advantages of coming here is that everything's measured and factual and objective. So there was the CT, the MRI, T-scan, the EMG and joint vibration analysis, all the different types of scanning, and you could see the numbers, and you can trust them much more than subjective data stuff.
100%. So we did the DTR on you a couple days ago, and you're a little bit. You tell me, how are you feeling?
My bite has changed completely. I can feel the teeth coming together an awful lot better. So the bite is not the same. It's completely different. I used to have my tongue thrust up against my front teeth, and now that isn't happening. It's kind of sitting, kind of rested in its normal position, I think. So the bite's different. It feels different.
In a good way?
In a good way.
0 to 10.
Headache?
Headache.
5 out of 10.
Both sides?
Both sides. It's equal on both sides.
Equivalent.
Yeah. Yeah. Well, I think my pain level was 5 out of 10 a few minutes ago. I'd rate it at 3 out of 10 now, following the bilateral blocks.
Mm-hmm. All right, so let's hit your posterior rami.
Right. Okay.
Yeah, it is a little. Yeah.
So what do you got? What's it doing?
2 out of 10.
2 out of 10?
Yeah.
So it is a little different.
It is a little bit different.
Little
Honestly,
bit.
it is a little bit different.
On both sides? Left
On both
and right.
sides, always bilaterally symmetrical.
Okay, so, all right, so in summary, you started out with 5 out of 10, both
Yep.
sides.
Yeah, yeah.
We got you down to 3 out of 10 with the anterior rami, which is greater auricular nerve blocks.
Yeah.
And we got you down to a 2 out of 10 with greater occipital, which is posterior rami, C2, C3. So what did you learn in this trip? What did it do for you?
I learned that there are several layers of pain inputs. Obviously, the layer that we can most adequately deal with here is the teeth.
Yeah.
But the imaging has helped to kind of look at the joints and whether that forms another layer as well. And also cervical spine, whether there might be some inputs in terms of pain there. So I learned a lot. When I was in the UK, I thought that things were psychological in terms of causes, and
you're a psychiatrist.
And I'm a psychiatrist of all things. And I thought if only I would relax a little bit more, not clench my teeth at night, that was going to be helping. Little did I know that my ability to control my clenching and grinding at night was completely out of my control and not psychological in origin. I didn't know that, and it was probably subconsciously my teeth trying to get back into alignment and the joint getting them to where they really wanted to be.
Please get that out to your profession, to the medical profession, to the dental profession.
Yeah, I didn't know that would be the cause of all this clenching. It's actually trying to get you back into position, but it can't do it.
Yeah.
And so hopefully, my hope is that, my bite feels perfect. My bite feels completely different, but my headaches haven't gone. But that might take a period of time.
Slightly better though.
It is better. It is better.
Maybe what?
Little bit better. 20% better, 30% better.
Yeah.
Something like that.
There's something.
There's something in it. There's
So
something in it.
30% of your inputs, of your layers, were related to dentition.
Yeah. I'd agree with that.
Yeah, the teeth that are sensors, basically, to central nervous system.
Yeah.
Yep. So the alignment was out of whack. So that was
Completely.
a quarter of the problem.
Yeah.
So now the other 3/4 is likely neck and joint
Joints.
itself.
Yeah.
Yep.
And now I have to go and see what I can do about those two areas.
Yeah.
See what I can do.
Yep. There's hope now.
There's hope. At least I have information. I'm armed with information that I did not know, and it seems very few people know. It seems nobody knows. 2017.
You know, Mike,
I don't understand this. People don't know. You've come across something that people don't know. It's unbelievable. How many people actually ever get that? Very few.
Yeah. Yeah, I guess in
unique.
a way I'm lucky, but in a way I'm cursed.
yeah, well,
Yeah, it's a double-edged sword.
Yeah.
The good part, and then there's the
Yeah.
convincing other people who don't want to know. Yeah, it's political. Yeah, I think it's political, it's financial, it is. There are people with a vested interest in teaching.
Are you glad you had all this done?
I am very glad. I'm glad that I came out here. I'm glad that I've gained more information. I'm glad that my bite feels completely different. Overall, it was a good experience. Yeah, I'm glad I came.